Dean McGee Eye Institute is very unique in American ophthalmology in the fact that it really is an independent, nonprofit organization that houses the Department of Ophthalmology for the university in a very effective partnership.
We had an unusual hybrid because the idea was to have a not-for-profit organization, the Dean McGee Eye Institute, would have doctors working for it, and their practices would be conducted there. There would also be faculty members who were practicing, but it would be hard to tell the difference to the outside public.
Jim Tolbert, Dean McGee, Stanton Young, and Tom Akers were critical in establishing that culture back in the early 1970s.
Mr. McGee had a detached retina, and he had gone to his ophthalmologist and referred him to Tullis Costin and Tommy Akers, who practiced with Tullis Costin, and they successfully reattached his retina. But in the course of that, there was much conversation about why there was so limited number of specialties, eye specialties in Oklahoma City.
If you look at the dedication plaques for the building that was built in 1975 and the building that was built in 2011, there are only two names of board members on both of those plaques. One of those is Stanton L. Young, and the second is Jim Tolbert.
It was under Jim's leadership, really, that the Institute became an elite research institution. That did not exist before Jim and would not have existed, I don't believe, were it not for Jim.
My dad gets a lot of accolades of, being the first founder and first director, but the idea of an eye institute to serve all Oklahomans and for research and resident training was not just my dad's, but really in his view, it was very much a team effort.
But Tom's real commitment, I think, his deepest commitment was to education. He really wanted to train doctors. We did a national search for a new executive and found this very young, very visionary, very imaginative young man in Houston. I think one of the most important things David did, he did very early. He recruited Gene Anderson from Houston to come and be the director of research.
And it was really with Gene's recruitment in the mid-1990s that the Institute really began to acquire National Eye Institute grant support.
And that resulted in a very short period of time, really, less than 10 years, that we became the 7th or 8th largest NIH-funded ophthalmology center in the country. So David, I think, took us to the next level, literally. But if you were going to continue this expansion of research and expansion of clinical care, you needed a better building and a bigger building. Greg has a great capacity to create a collegial environment. He builds an internal collegiality in the organization that was never there before, ever.
1, 2, 3.
It has given us wonderful space to bring all the pieces of the organization in from all sides of the campus and to recruit new clinicians and new research people with ideal facilities.
I mean, we really are world class. It's amazing, really. I don't really think the state of Oklahoma knows how special this place is. The rest of the country does. The rest of the world knows.
It is going to be one of the world's great organizations in eye care, both in research and in education, and particularly in clinical care.